Hi, everybody. Good evening and welcome to Conversations with Caregivers. My name is Lindsay Garcia, and I'm the Executive Director of the 22Q Family Foundation. And I'm also a caregiver to an almost 12-year-old. And I'm really excited to have our second conversation with caregivers. We had such amazing feedback from last week. And I'm really proud and excited to introduce you to Brittany Harris. She's a mom that lives in Hawaii with her three boys, both biological and adoptive. Her youngest son, Dax, is 3 years old and he has 22Q. She's been an RN since 2010, and most of her career was spent in the emergency room setting. She currently works as a nurse coach and also teaches courses like CPR and first aid. And being that she lives in Hawaii, her and her family spend a lot of their free time at the beach, which I'm very jealous of. She loves surfing, fitness, and good coffee. Well, welcome to our conversation, Brittany. Thank you so much for being part of it.
Thank you so much. It's such a pleasure to be with you tonight. I'm really excited about this. So,
Awesome. Well, yeah, so part of why we decided to do this kind of series this month is our theme for this year's Awareness Month is Look What I Can Do, and obviously focused on the individual that's affected by the diagnosis. However, we know that 22Q and other diagnoses sometimes affect the whole family, caregivers being one of those people. And would love to get just like the perspective of the caregiver, kind of navigating this journey. It's nothing that anyone, necessarily signed up for. Sometimes that is the case. But it's a unique journey, and you have a very different and interesting perspective when we were kind of doing our pre-call planning meeting around being in the medical profession already prior to having Dax. So let's start with you sharing a little bit about how Dax got diagnosed.
yeah, sure. So Docs did get diagnosed prenatally. So it's wild. I was actually just talking about this with my husband yesterday, and it like brought tears to my eyes again, just because I think that might have been like honestly the hardest part of our entire journey was the pregnancy, which just I think emotionally for me it was really really hard. So we had a lot going on. So our first son was probably about three, and he was a biological child. He had actually had some surgery the first year of life, so we were not total strangers to some medical needs. And then obviously I'm a nurse, so have that medical background. And then we also had a special medical needs foster baby at the time, who's now our son. And so so I was pregnant with Dax, and we went to that 20-week anatomy scan and got bad news. I mean, we found out he had a right aortic arch. I think they saw VSDs on that scan as well, and then he only has one kidney. So, when they told me he had like multiple body system, anomalies, I was like, this is bad. This is bad. We ended up getting the diagnosis a little while after that because we didn't get an amnio right away. We decided to go with some blood work first, but it was suggested of 22Q, and then we got the amnio to confirm. So it was a crazy time because then it was suddenly like we obviously didn't know what our foster son's future held at all. And then having just this huge looming unknown of what life was going to be like with 22Q with Dax. It was a really difficult time for me. Actually, the pregnancy was really hard.
Yeah, I say I'm also diagnosed pregnant at like 20 weeks. So yeah, it was definitely had another pregnancy before that, and it was a lot more blissful,
Hmm.
and just more relaxing. And I feel like yeah, I just was met with a lot of like I just kind of dove deep into research, and that early diagnosis we always say is key, but sometimes depending on your personality, you can really dive deep into the research and like all the unknowns of like what's gonna, become of your unborn child. So totally can feel you on that. What has been like share about like some of Dax's struggles like over his life so far?
Yeah, I'll start by saying he's honestly done really well overall. And we have a lot to be really, really grateful for. Obviously, I think as an ER nurse, and looking into more of the diagnosis, I was prepared for the worst for sure. That's just where my mind went. And he's been honestly done really amazing. We've stayed out of the hospital for the most part. I mean, he's had a couple hospital stays, he was in the NICU and stuff, but overall done pretty well. But his biggest issues and biggest struggles have really just been constant illness. He's three and he has two brothers. I mean, we had three boys within 4 years of each other. So obviously they're little germy petri dishes. And we really isolated him like his newborn period. But after that, like he literally he's been sick like half his life and really struggles with just simple viruses. He really, really struggles to get better. And he also has multiple airway anomalies, which I feel like is probably his biggest issue. He really, for 2.5 years, did not sleep very much at all because with any little cold, any inflammation at all, he really just had a lot of trouble with breathing at night, especially. And so he didn't sleep, which meant I didn't sleep. And so, yeah, so he has these airway anomalies. The biggest issue is probably his vascular ring. So, he's diagnosed with the right aortic arch prenatally, but we take him to a vascular ring team on the mainland in Southern California. And he actually technically has a circumflex aorta. So he does have that tracheal compression and esophageal compression, which I think is one of the issues with his breathing, though he is doing a lot better right now. But he may need a big surgery to uncross his aorta at some point. That's been recommended, and we have not done it yet. He's actually been doing pretty well lately. But I feel like that's probably been, of all the things, that's probably been the thing that impacts our day-to-day life the most, has been just like nighttime breathing and sleeping issues. So,
Yeah, and when they don't sleep well, like you're not sleeping well, so it can be, yeah, kind of overwhelming.
I mean, yeah,
Yeah.
countless nights of
Mhm.
up all night with him, like
Yeah.
so many nights. Yeah.
Oh. So I'm guessing, yeah, that's been one of your biggest struggles. I know you talked about obviously with the pregnancy. Have there been any other struggles with you, like as a caregiver, navigating this, navigating the diagnosis or just providing for him?
Yeah. Yeah, I mean, I think there was a lot of grief for me, and especially in that 4 or 5 months of waiting to meet him in person and just worrying about the worst. So it was a lot of grief for me, and I think it still comes up here and there, but the unknowns were the worst part. And then once he was here in my arms, I was like, now I feel like I can do something, like I can care for you, and he's just such a joy. He's such a joy. But I think for me, it's been a few things. Really, the isolation. Like I was home a lot for a couple of years with three very small boys, and just not being able to leave the house much because Dax was so sick all the time. It's like, I'm not going to take my kid out when he has a fever. I'm not going to take him out when he's, having breathing issues or coughing a ton. And so we were just home a ton. And I went from being like a career person to like really primarily being home for a couple of years. And so I think I really had to figure out a way to like care for myself. I was not taking good care of myself for a while, being up all night and just tons of coffee and just trying to keep all the boys alive and well. And it's just a
Yeah.
ton of, learning how to like, where do I fit in caring for myself in the midst of all this kind of stress and lots of driving for doctor's appointments and all of that. And then also learning to kind of build a community because I was so isolated and I'm not normally that kind of person. And so it took a lot of work for me to go like, who are my inner circle people, and like really reaching out to them and ask, like trying to keep community in the midst of physically being isolated a lot at home with a sick kid was
Yeah,
hard.
no, I hear you. Yeah, between like illness and navigating things, whether it's people have older kids with school and IEPs and things, lots of things that maybe many of us as caregivers have never had to deal with our other kids. And there's no guidebook for this, just like there isn't for, neurotypical kids. So, it's one of those things like community is huge. And whether it's community around you or, finding community within the 22Q, network. Some of my closest friends are 22Q moms because they just kind of understand the journey that I'm on as a mom, and I don't really have to explain myself. I don't feel judged. My parenting is not questioned. I could go on and on.
Yeah.
Um, so yeah, okay, so you answered that question. How have you shared a little bit about adapting as a mother raising a child with special needs with 22Q by obviously, talking about kind of your own personality style and like what you were kind of used to doing, career changes. Has there been other things that you've had to adapt to?
Yeah, I think being home for the most part was a big change for us. And that brought along other challenges too. Like we live in literally one of the most expensive places like ever to live, and going from two incomes to one was quite an adjustment. And just I think learning how to live on much less sleep and not knowing, it's like, is this forever? Am I never going to sleep again? Like, how do I function on such little broken sleep? And so it took a lot of work to just find our new normal as a family. And also figuring out how to still make sure my other kids get, like his brother, who's only 16 months older than him, who we adopted, making sure that I'm, giving him enough attention, and then, addressing the needs of my oldest. And so it took a lot of adapting, and a lot of it for me was just learning how to get a little bit of space, even if they're just micro breaks
Mhm.
alone, to kind of reset. Like, I'm a spiritual person. I need a little bit of time to just kind of like, connect and pray and have my time. And I'm a mover. Like, I've been working out my whole life. And so learning even just to find little ways to move, even in the midst of really stressful times, was huge for me. Those are things. And I really had to learn to control my mind, which I struggle with, where it's like, what thoughts are helpful and what thoughts are not helpful. Like, I think grief is very real, and we all, I think, grieve when we get a really hard lifelong diagnosis. But then it's like acknowledging my emotions, but also learning when, okay, certain thoughts, like why, and it's so unfair, and these kinds of things, like at some point become unhelpful. And it's like, we need to look forward, and I need to be present with my son. Like, my kids need me to show up as the mom that they need. And so how can I do that well in the midst of a lot of demands with my
Mhm.
kids, especially docs, and a lot of doctor's appointments and a lot of stressors. And so I'm really learning that. I'm still just very much in the process of learning that. And, um, I do coaching. And so it's like a lot of the time it's like coaching myself, and learning to kind of, um, what thoughts are helpful and what thoughts I need to kind of let go and move forward from, so that we can do the best we can with the situation we're in at the time.
Yeah, I love that. I think everyone needs reminders of that. Really too, like when you're talking about, like we talk about 22q, it is a lifelong diagnosis, and it, sometimes it comes in waves and we don't know what the future brings for some of our kids. It's a lot of thoughts that go through my mind are like really way down the road, which, I have a 12-year-old, I still have some time, but it's like day in, day out, like really being there and present with them. And I know for a lot of our kids that have a lot of medical needs, my son included, I look back at those times and like there are some times where you really can't be present because you're, really just trying to keep them alive. Like I was really trying to keep my
Totally.
son alive between all the stuff he had going on. But then we got to a point where I was like, okay, now I can actually enjoy him. But it had been like 6 to 8 months, not from like day one, like I did with my daughter. And so yeah, so I struggle sometimes with that grief, but it's also like, that moment I did need to live kind of day by day. And yeah, I just love what you said about the thoughts. That's really something I'm going to take to heart. So
My
when we
husband actually is really good about reminding me of that. Like,
oh,
Britt, don't miss the joy. Like, don't miss
mhm.
what's right in front of you because your mind is going about his next appointment or whatever's coming up next. Or like even just literally winter. I know we don't really have like winter in the way that you think
I
of it, obviously,
know
but
winter.
we do have like flu season and RSV season. And like we've had some really brutal winters with docs. And so even just the approaching of winter this year, I was like, like, and my husband's like,
Yeah,
don't miss these moments. Like,
yeah,
don't miss these moments. When he is healthy, we just have to really, really enjoy it. Because it doesn't do any good, right? For me to be worried about
yeah.
like next
We
week
always talk
or,
about here like leaning into the lulls, because it is a little up and down
mm,
sometimes with diagnosis, but like it's just a reminder, like there are going to be many, many things that these kids do that are just developmentally appropriate. And a lot of times we miss that, because we're so focused on like, okay, they're behind in school. So now I need to advocate for them at school. I need to do this research because of this, procedure coming up or this medication that I might try on my child or whatever. It gets kind of all consuming. And so a lot of times I just tell parents of younger kids, like, just enjoy them, as much as you can.
yeah,
Especially if they're like medically stable, just enjoy them. Um, because they're still
yes.
your babies, and they're still little humans that we brought into this world. They just need a little bit more love and support. So this is my favorite question that we're going to talk about as we were kind of prepping for this. Um, and part of why I asked you to do this was, partially stalking you a little bit on Instagram and watching some of the content that you put out as a mom, but also as a nurse. Um, and would love to, because you're a medical provider, talk about like realistic expectations that you kind of want to share, knowing about what you know about the medical field, but also about like the lack of awareness with 22q. Um, everything.
Totally. Yeah. Yeah. I love talking about this because it's so near and dear to my heart as both a registered nurse and as a mom of, I never thought I would be on this side of the
Mhm.
provider patient family relationship, but here I am. And that's been a big adjustment for me. But, I think a few things, and I know many of us are super, super grateful for the doctors, especially the ones that we've really connected with and have really gone above and beyond for our child. And we're so grateful to them. But I also think that in our passion for advocacy for our kids and wanting them to get the best care possible, it is easy to get kind of cynical or frustrated with the system, right? And not feeling like we can get our kids what they need. And that's a real thing. But I think it's just important for us to remember that doctors are just people, right? They're real people. And most of them are truly trying their best in a system that's also not really set up in a way that benefit like works for them. Honestly, a lot of these big healthcare systems, a lot of stuff is outside of the physician's control. But a lot of my very good friends are doctors. I have like at least a handful or two of very good friends that are physicians, and they're just truly, truly trying their best and care very deeply about their patients. And I think just having realistic expectations. So even as an ER nurse, like I was not familiar with 22q. I actually found out about it because another person I worked with in a hospital had a child with it, and that was my first introduction to it. And then I learned some about it, and then ended up, with Dax, and obviously have learned a lot about it. And I try to stay up to date on stuff. But one of the things I think is important is to realize that not all doctors are going to have the same amount of knowledge about it based on their specialty, right? Like our geneticist knows so much about 22q because she trained at CHOP, and she, which is, has a 22q in your center. And so she's very knowledgeable, and she really is like his quarterback is what she called herself. And I didn't realize how important that was because he was a baby when she said it, but I realize now how important that is, that there's someone that's looking at the big picture and kind of calling the plays and making sure he gets referred to all the right specialists and gets the right screenings done. And she really follows the guidelines. And so that's been huge. But then, when I go to see certain specialists, I recognize like they may have only ever seen a couple of kids with this. It may have been a while. Like I don't ever ask them like, how many patients do you have for 22q? But we live on a small, there's only about 1 million people on this island. So I know that, I think depending on who I'm seeing, or if I have to take them in for acute care to the ER or an urgent care, I come in realizing they may not know about a ton about 22q. And I think the way we approach those doctors is really important. And you and I talked about this. I have a very good friend whose son also has 22q, and at their pediatrics office, it's not in Hawaii, it's on the mainland, but they're a star patient. So they always get double books. They get a little bit of extra time just knowing that he's complex, right? And things like that, which I think can be really helpful. But I do think having a doctor in your corner, whether that's your pediatrician or whether that's your geneticist, who's really willing to be that quarterback and who's willing to really look at the guidelines and make sure they're being followed. They're willing to learn, and most importantly, willing to listen. Like, I don't know, I could cry because some of our doctors are so wonderful. Like they just care deeply. And I think here in Hawaii, we're really lucky that like the ohana, the family is very important. So they're really good at like listening to us and having really open conversations. And we feel very heard and seen and that kind of thing. Especially like our ENT, our infectious disease doctor who basically does immunology. Obviously our geneticist and our pediatrician, like I'm just so grateful for them. And it's not necessarily that they have obviously knowledge about 22q, but some of them, it's not even so much what they know, but that they're willing to listen and learn. And I really appreciate them. But we've also been to doctors that were like, I understand the challenges physicians face and the time constraints and the short appointment times and stuff, but we've seen a couple doctors that we just won't go back to. And I think just acknowledging like that doctor's just not for my kid. Like if they can't be, bothered to open his chart at all and have no idea about any of his medical history and then aren't willing to look or learn, or like that's someone that I'm like, yeah, I'm sure you're good at your job. I'm sure you're good at doing surgery, but we're probably not, we're probably not going to go back to that doctor, and that's okay. But I think just realizing that like, depending on the specialty, they may know a lot about 22q or they may not. And I think that's why it's really important as families for us to at least be familiar with the guidelines, maybe print it out or carry it with you. So that we can approach doctors with helpful information, but in a way that keeps them in the expert role, knowing they know a lot about their specialty for sure. And they have tons and tons, tens or hundreds of thousands of hours of experience in this specialty, but they may not know that our kid is at risk for this thing or that thing, or they may have very limited knowledge about 22q. And so I have certain ways that I ask questions or approach things that allows them to learn information that's important, or for me to share my concerns, but also keeps them in the expert role. So I'm still honing in how to best approach physicians in a healthy way. So
No, that's all really helpful. A lot of time, and I love the quarterback kind of metaphor. We get calls a lot of times, people asking like, or I see kind of on the online support groups, like I live in this area, and everyone always wants the pediatrician or whatever doctor that has the specialty in 22q, right? And really you only see that if you tend one of these clinics across the country, which luckily more and more are popping up, but a lot of people do not unfortunately get access to those. So what I always tell them is kind of similar to what you said, like someone that's willing to learn, someone that's like honestly really good at like giving referrals because most likely you're gonna need a bunch of them. And the
Yeah.
double booking, like that was a game changer for me. And I never asked my pediatrician to do that. But I think after the first time going to see her and it taking 45 minutes because of just at the time he was really medically fragile, she purposefully did that. And it was so appreciated because then like I didn't feel rushed, she didn't feel rushed. She could really do like a thorough visit with him. And so that's something that I always encourage people to ask for if at all possible. So I loved all those tips that you shared. Um, so then kind of continuing on with like medical community though, now being on the other side, something that you never really thought would be your spot. And similar to me, so I previously was an educator, always was on the other side of the table at IEP meetings, advocating for my students. But honestly, looking back now, if I ever went back to teaching, I'd probably be a much better teacher, especially for these special ed kids, because you don't know that journey or that life and what those parents are like asking for. Um, so going back to medical, they're like, what would you like the medical community to know, kind of with your experience now raising a child with 22Q?
Yeah, I think the biggest thing is honestly just that there are guidelines. I think a lot of physicians don't know that. And it's like so many physicians and providers have put so much time and energy, and there's so many research articles that have gone into this kind of concise document that can really guide care for these kids. And I just think it's so helpful. And I just wish it was in the hands of all doctors who are going to be seeing kids with 22Q. And so I mean, even like figure two in the guidelines is like a document that shows kind of like all of these different medical conditions that they're at risk for and how common, which ones are common, which ones are rare, which ones are rare but really significant that they need to screen for. And I just think it's just like gold. And so I just think it's important for doctors to know that they exist. And secondarily, I would just say to just listen to parents. Like if a 22Q parent is telling you that something is going on, it's like it really warrants investigation. Like your threshold for concern should be much lower with these kids than with other people because every body system can be affected, and there are so many different manifestations of 22q. And so I think those are probably the two biggest things. And what I really try to do, like if I'm seeing a doctor for the first time, especially if we haven't been established with them before, and I don't know how it's going to go. Usually, like I kind of let them do their thing and stuff. And then if I feel like they haven't really touched on something that probably should be looked at as far as 22q, I'll say something like, oh, hey, I know when they updated the guidelines a few years ago, one of the things that was mentioned that's within their specialty is X, Y, or Z. And so I would love to hear, like, with your knowledge and with your experience, do you think that's something we should be concerned about with Dax, or is that something I can feel reassured is not an issue for him? And that way, it's like it's bringing up my concern based on the evidence, evidence-based guidelines, but it's also putting them back into the expert role to know that, like, you're the expert, you're the doctor, you tell me whether this is something that needs to be looked into, or whether I can be reassured that this is not an issue. And so that's kind of one of the ways I approach them. But yeah, I just think like I'm ultimately just so grateful. Honestly, we have really our pediatrician is just like, I just appreciate so much the doctors that are in our life that are just, they just care deeply about Dax, and they listen, and they're really wonderful. So
Amazing. Well, this was such a pleasure to have you on. Is there anything else you want to share before we log off?
no, I think that's it. Just I know it's so hard because I feel like I hear this all the time, like try to be present, but it's so true. And I think, man, I could never have imagined when I was especially if like their parents listening who are maybe newly diagnosed, or it's really scary right now. Like I truly never could have imagined how much joy Dax would bring into my life. Like I never, like especially in my pregnancy, like I never could have imagined how incredible he would be.
Mm.
And just all of the work we put into helping them thrive, it's just so worth it.